Kids getting their hands on cannabis edibles is landing them in the hospital at an exponential rate. Joining us is Dr. Christopher Pruitt, medical director at Shawn Jenkins Children's Hospital. And how bad is it, doctor, for a child to ingest a cannabis edible?
It can be pretty dangerous. You know, most people, when they think of cannabis edibles, are thinking about, you know, maybe getting high or having some sort of euphoria. And while we certainly see that with older kids as they approach sort of adult age ranges, what the latest research is talking about and what we're seeing a lot of is when young kids get into them. And that can look very different for those kids and can be pretty dangerous for them.
I can imagine so. So when a child comes to the emergency room, typically, is it after having one of these gummies or whatever it may be? Is it 2, 3? Is it the whole bottle? What is it?
It depends. It depends. And as you can imagine, these products come in, you know, very varying kind of potencies and things like this. And so it can be really different. But when young children present, they often look very different. They can look very out of it and be pretty lethargic and things like that.
What is a treatment for a child who's in that state?
So it's basically what we call supportive care. There's no like antidote for it. And so we have to support their body with IV fluids, breathing support if we need to, make sure that their bodily functions are being supported while their body clears the toxin.
Could there be permanent damage because of this?
Luckily, there's been very little data that have revealed that there's permanent damage. Usually if a child comes to care promptly, we're going to be able to provide them the care they need so that they'll end up ultimately being fine. There has been one case reported a couple of years back from another state where a Delta 8 edible was implicated in a child's death. That's still not super clear whether that was the case or not.
And explain what a Delta 8 is. What does that mean?
So Delta 8 is almost like a chemical analog that's very close to THC, which is the active ingredient that most people would consider to be marijuana or a true cannabis gummy. And so lots of people can find those kinds of products on the internet and really in different kinds of shops and places like that. And most parents are pretty well intentioned. This is not a very overt case of neglect in most cases. It's usually, you know, kids being curious and getting where they shouldn't be, which every child does, right?
Sure.
And so if you have something that's packaged or appears to be something that looks like candy, which if you do an internet search, you'll find a lot of these things look exactly like candy that's marketed in normal stores, then a kid's gonna get into it.
Is it possible, because sometimes with chemicals, cleaning supplies and things like that, we've heard, you know, children, they accidentally ingest something, not knowing what it was, and then they could have their stomach pumped or whatever. But in the case of an edible, would it have to really kind of be digested in order for it to start presenting? And then at that point, like you said, supportive care. So there's really no removing it from their system. It's just
that's
letting it wear off.
Exactly the case. Correct.
I see. And so if a parent does notice that a child is in that state, what should they do?
Well, they should bring their child to immediate care, to medical care immediately, and most do. And sometimes parents aren't even aware of what's going on, and it's only when questioned or when they, you know, you sort of run the possible scenarios, they go, oh yeah, I guess that could be. But most parents will say, well, no, there's no way they could have gotten into anything. But the truth is, I mean, kids find a way.
They always do. They always do. They're very crafty that way. I want to thank you so much, doctor, for joining us today.
My pleasure.
We're back after this.